So what about a person that has really bad teeth and they need a full mouth of extractions? You can't save them anymore. What are their options in your practice when it comes to dental implants?
Right. So that is very frustrating for some of those patients. You know, those were the ones that, you know, did those deep cleanings, and, you know, they're really frustrated because they're doing what they're told, and, you know, their provider is like, oh, you need to do more deep cleanings, and those are painful. Or they're wondering, they're doing them and nothing is changing, and why does it look like their teeth are long or gapping out, or black triangles, or loosey-goosey, or funky smells, and, you know, they're frustrated. So the reason is that gum disease is, you know, there is a genetic component, of course, and it really is because of that, you know, blood and the ligament really that the tooth is attached to. So when that tooth comes out, there's no longer that ligament, so it really is free from that disease in that area.
So their gums get healthy after the extraction?
Exactly. Their gums get healthy because that little ligament is no longer there, which causes that disease.
Okay.
So it's like a clean slate. It's like taking, you know, a tree that had an issue out of the soil, clean soil. So we can now put that implant in, and it can be healthy and it can thrive. So patients that are really going through the whole mouth of problems can come and get as little as 4 implants placed, and a full arch of teeth back that look gorgeous.
And don't come out.
And do not come out. Clean slate, fresh ground.
You call it a third set of teeth?
Third set of teeth, yes.
Okay.
And I like to say, you know, in the world of construction, yes, it is a tear down instead of a remodel for those who have their whole mouth. It's like you got an old house.
It's not a fixer upper. You just remove the teeth, give them a brand new set of teeth.
Right, and now they're finally happy with their look. They're finally happy that their teeth are strong. They're finally happy that they don't have to go through deep cleanings that are painful, that don't work. And they're happy that they're out of their disease, they're out of their pain, they can smile, and they're free from it all. So it's a really great process.
Now, what about pain? And I know, look, everybody experiences different, but it seems so painful.
No, because now the bad teeth are out that have been giving them their pain. It's that fresh slate again. It's that fresh ground that there's no more of those bad nerves anymore because that's gone.
What do they like eating the most? Is it salads, broccoli,
a lot of people like those crunchy vegetables, the salad. A lot of people like their steak. Corn on the cob is a big one.
Okay.
Nuts are big.
Like, because I was thinking, I was eating a sandwich. Like people, like a sourdough, stiff, sour.
Yeah.
You can't tug it out of your mouth if you have bad teeth.
You can't tear it, no. And, you know, that's the healthy stuff. The stuff that when people aren't able to fully chew their food, people are also noticing a lot of digestion issues. So now giving them their fixed, strong set of teeth, grind your food, no more upset tummies, no more bad digestion issues. So now people are getting healthier, more energy is coming back. And
you could be 80, 90 years old, you say, to do this?
Yes, there's no top age limit. There's a lower age limit.
They're not more likely to fall out when they're 90
than
if they're 70?
All the same proper protocol is followed at any age. Age is not an issue.
Now, what if you're on like a few medications? Because if you're in your late 70s, 80s, these people are on 3 or 4 medications. You'll work with that?
Of course, and even more so because a lot of, you know, modern medicine is amazing. And this is also a type of modern medicine procedure. So in modern medicine, dry mouth, everything, that helps teeth deteriorate even more so. So of course we tag team up with our general doctors that are working with our patients. We make sure that everything is fine medically. But you know, this is a form of modern medicine. In fact, those medications sometimes are allowing people to live longer, which is why they need better teeth to keep up with them living longer.
And your oldest patient that did this is like 90 what?
96 now. No, sorry. She was 96 when she did it. Now she's 98.
And she can eat whatever she wants.
Yeah. And I told you what her favorite food is, right? Chicken, walnut, fried rice at P.F. Chang. Yes.
And so what do they like more? Do they like the way it looks? Do they like what they could eat and chew?
Both. I have both kind of groups of people. you know, it's funny. I have like my engineers or my people who are like more analytical come in. They're like, oh, you know, all about function. And then they're looking in the mirror and they're like, dang, you know, looking all good. And then they're asking me recommendations on eye cream.
Okay.
And this is like super like, you know, rugged people or like, you know, very into the analytical, you know, functional aspect. Then I'll have like more of the people who are into the aesthetic, cosmetic.
They just want a pretty smile.
Yes, and then they're like,
smile.
oh, I can chew fantastic. You know, my function is amazing now. I can really, you know, grind up my food and I can, you know, my digestion is amazing, or I can eat this and I can eat that. So it's cool. You see both ends.
Now, this is one of those things in dentistry,
Yeah.
right? You could do like a brilliant crown or root canal or whatever.
Yeah.
But you say that there's nothing in dentistry that compels people to want to hug you. And
Right.
want to give you gifts.
Yeah, I know.
Is that right?
I think I mentioned this to you before in the past. I mean, in dentistry, you know, you do great work and everything, you know, you do beautiful, you know, crowns, you know, fillings, whatever, but you don't get like tears of joy or someone looking into a mirror the moment you give them their teeth, crying or jumping out of the chair or having their spouse literally drop to their knees when they look at their...
Wow.
Yes. So this is where this kind of work that I do, this is where you see that.
Okay, and you're a board certified prosthodontist.
Yes.
Doesn't cost more, you say, to go to a specialist.
Right.
In fact, it may cost less to get it done right the first time.
Right. So as a board certified prosthodontist, it does not cost more. In fact, you know, after you might have gone to other providers or done all this other work, maybe just come, let's do it right the first time and you'll save.
You know what the big guys are charging, and you're a little bit less.
Yeah.
Is that right?
Yes.
Or even a lot less.
I am. I feel that I am because I want more people to have an opportunity to see me, and I do truly love what I do. So I feel like people deserve to be able to see me and I want to help them.